Hello friends, I have discussed about the mnemonics which are used in the while history taking. So now I am going to describe in detail about those mnemonics and what to ask in the history. So this we have discussed already. So coming to fever, chills, night sweats, PPD, okay, when you hear fever, chills, night sweats, you have an idea of tuberculosis. You get an idea of tuberculosis. Then you can ask this: PPD test, was it done or not, and when was it done, and what was the result? Okay, and then you can ask for cough also. Whenever the cough is a symptom, then you can ask for ABCO. That means amount, whether it's associated with blood in it, and C for color, O for odor, smell of it. Okay, and you can ask for relation with the timings of the day, whether the cough is more in the day or in the night, like that, or seasonal or something like that. And then regarding the flu symptoms, you can ask like runny nose, watery eyes, sore throat, etc., and nausea, vomiting. And then coming to sleep, appetite, weight, energy. So regarding sleep, this is most important where you can get more of the diagnosis DDs. So sleep, whenever you ask for sleep, you ask for whether there are any early morning awakenings, nighttime awakenings. Ask for whether there is snoring, choking, fear of impending doom, uh, and daytime naps. Daytime naps, snoring, all you see in obstructive sleep apnea. So you'll get one DD over here. Nightmares, flashbacks, restless legs can ask these symptoms. And appetite, weight, if there is loss of appetite, loss of weight, you can suspect for any malignancy. And energy, low or tired, that means you can suspect a DD of anemia. And whenever the person says low energy, then you can ask for OFP, onset frequency progression. Okay, and then you can ask for bowel symptoms like constipation, diarrhea. If they say yes, you can ask for amount, blood, color, odor, and then you can ask for tenesmus, dyschezia, hematochezia, melena. Mainly, you can ask for change in stool caliber. If they say there is yes for this question, then you can suspect the malignancy, colon cancer. Okay. Then for bladder symptoms, you can remember this mnemonic, fun DRSS DIH, where fun means frequency, urgency, nocturia, dysuria, retention, strain, stream, discharge, incontinence, hematuria. So how do you ask for frequency? Frequency means you can ask like, do you have to pass urine more frequently than usual? For urgency, you can ask like, do you have to rush to urinate? Nocturia, you can ask like, do you have to wake up at night to urinate? You can see. For dysuria, you can ask like pain, whether there is pain, discomfort, or burning while urinating. And for retention, you can ask like, do you feel a sense of bladder fullness even after passing urine? That's a question. And for strain, you can ask like, do you have to strain during maturation, or do you have to strain to pass stools? That is for dyschezia, you ask. And in case of stream, you can ask for any change in urinary stream, or any dribbling you have noticed. And for discharge, you can ask like, have you noticed any discharge in the urine? If they say, you ask for ABCO again, amount, blood, color, odor. And then for incontinence, you can go for any trouble holding urine. And you can, if they say yes, then you can go with other questions like any trouble holding urine while laughing, coughing, or sneezing. If they say yes, that will be stress incontinence. And another question will be, have you noticed any leakage of urine which follows a sudden strong urge? If they say yes, that will be urge incontinence. And the other question will we can ask is, has it impaired performance of your daily activities? And you can ask, are you consuming more fluids than usual? Polyuria. Okay. And for hematuria, you can ask for, have you noticed any blood in urine? And for this the symptoms, you can ask for questions, you can ask for bladder symptoms. And coming to mood, there are some mnemonics like SIDGE caps for depression, safeguards for abuse, nightmares. You can ask whether you have, are you having nightmares, hallucinations, delusions, and you worry about anything. Pressures, is there any pressured speech? This mnemonic HOTS med AC is for ADHD. If you feel that child has ADHD, can ask the symptoms. So coming to depression, you can ask mood plus itch caps. You everyone knows itch caps. Mood plus itch cap and more than or equal to 5, that will be depression positive. You can go for a DD of depression. Itch caps to elaborate, it is sleep, interest, guilt, energy, concentration, appetite, psychomotor function like irritability, any suicidal tendencies like that. And for abuse, you can ask like safe at home. Safeguard is a mnemonic used. Are you safe at home? Are you afraid of your spouse or boyfriend? How, does your family or friends are informed of abuse? Do you have any emergency exit plan? Do you have guns at home? Is your spouse alcoholic or and is your spouse alcoholic? How is the relationship of your spouse with others or the children? And ask for depression symptoms also. So with these questions, you can know whether the patient has underwent abuse or not. And the other is ADHD. We use a mnemonic called a HOTSMET AC. You can ask for homework. Um, have you do you notice any difficulty finishing your homework, home task like that? And for organization, you can ask like, do you have trouble performing organized activities? And turn, do you have trouble waiting for your turn? Stand still. And do you have trouble stand still? For misplace, you can ask like, do you misplace your things a lot? For interrupt, you can ask like, does anyone ever told you that you interrupt others while they are talking? And distracted, do you get easily distracted by TV, people, or jokes like that? You can ask. And for active, you can ask like, do you feel overly active as if driven by a motor? Childhood, do you have similar complaints in the past? And along with all these, you can ask similar symptoms in both school and home. If they say yes, then that will be a diagnosis of ADHD, attention deficit hyperactive disorder. And coming to TTT, triple T, trauma, travel, thyroid. Trauma, if they say yes, falls, you can ask for bruises and abuse symptoms of safeguard. And for travel, you can ask for recent immobilization. That says you can suspect pulmonary embolism if other symptoms are also present. Cooked food and drank water from ponds, if they say yes. In case of diarrhea, you can ask these questions. You can suspect infections. Thyroid, you can ask for any skin changes or hair changes, hair loss, dry skin, moist skin, hand tremors, temperature intolerance, whether it's cold intolerance or heat intolerance, skin pigmentation. Well, by this you can know whether it's hyperthyroid or hypothyroid. And next will be CAR. Caffeine intake, you can ask in case of palpitation is a chief complaint. He'll contact whether if you suspect any infections, and ask for whether if you have you eaten outside recently in case of diarrhea like that. Rash, if the patient says rash, you go ahead and ask these questions like tick bite, joint pain, red eyes, eye discharge, discomfort, like that you can ask. And obstetrics, gynec, then you can ask for. I'll discuss system wise in the next session. Hope you enjoyed this video. Thank you.